my name is Brady Kirkman, and today we have with us Marge Paschke on the Pulse. Hello, Marge. How are you?
I'm good. How are you?
Excellent. Well, thank you for joining us today. First time on the Pulse.
Yes.
So we're glad that you could join us. I understand that you have been with the auxiliary. Is that correct?
Yes.
And how long have you been on the auxiliary?
It was 25 years.
25 years. That is beyond impressive. That is commitment to a new level. Talk to our audience a little bit about, how did you first get on the auxiliary? What motivated you to do that?
Okay. A good friend of mine belonged to the auxiliary, and she had been talking to me, trying to convince me to join. And so finally I decided 25 years ago that I would join the auxiliary, and I'm very glad I did. I enjoy it a lot.
Didn't probably know it was going to be a lifetime commitment. So, well, that is really a humble service in all ways. What, over the last 25 years, what have you enjoyed about being on the auxiliary?
Oh, I've enjoyed the fundraising projects we've done. When I first joined the auxiliary, we did the Fall Festival, which was a fun event, and then that evolved into our 4 money-making projects, and I enjoy being a patient guide.
Well, the auxiliary and you have done a lot for the hospital. There's been a number of projects you guys have been instrumental in. I heard you mention a patient guide. Talk to our audience a little bit about what is a patient guide.
A patient guide is someone that is at the front entrance, and we help people that come in, patients that come in, to find the place they need to go. We can either walk them down to, say, the lab or somewhere, or we can take them in a wheelchair, or there's the shuttle bug that they can ride on wherever they need to go.
That first impression is so important with the people we serve, and as we continue to expand the hospital, obviously, there's probably more questions on where they need to go.
Yes, people are often confused as just where they need to go.
So, you've been on the auxiliary for 25 years. How long have you been a patient guide now?
It's about 4 or 5 years. I'm not real sure.
Okay. Well, excellent. That is a commitment. Is there anything, as people are thinking, hey, should I join the auxiliary? Is there any words of encouragement or words of advice that you could share with them?
Yes, it's a fun organization, and I feel it's an important organization to help support our local hospital.
Agreed. And then also, if they want to be a patient guide, what would you share with them about that?
That is also a fun way to help people and to help the community and people that come to the hospital. They could get a form from Katie Greener or from Mary Klosterberg, who is our president of the auxiliary. And any auxiliary member would be glad to answer questions if they have questions about it.
And you don't have to be an auxiliary member to be a patient guide, correct?
To be an auxiliary member.
And I think the other thing that's really important to recognize is to be a patient guide, you really kind of control your own schedule, don't you?
Right. You can pick the days that you are available to be a patient guide.
Yep. So it's not like you're committed to so many hours a week or anything like that.
No. Could be 1 day a month or 2 or 3, whatever fits into your schedule.
Anything else that you'd like to share with the audience about, your role as auxiliary or a patient guide?
It's just a fun thing to do. I enjoy helping people, and I think that's why I became a patient guide, to help people at the hospital.
Well, I just want you to know, on behalf of Windom Area Health, we are very, very appreciative of your commitment and what you do for both the auxiliary and the patients we serve. So thank you for that.
Thank you.
Well, and with that being said, I'll be signing off today. This will be my last episode of The Pulse, moving on to other adventures in life. But there'll be a temporary break in The Pulse, but it will be back. So make sure you stay tuned. Thank you very much for our audience, and we'll catch you next time. Hello, my name is Brady Kirkman, and today we have with us